Table 1 focuses on the head and neck muscles. The first one is the frontalis, which is raising your eyebrows. Next is masseter, elevation of the temporomandibular joint, which is chewing. Next is the orbicularis oculi, blinking and closing the eyes. Next is the orbicularis oris, which is closing mouth and protruding the lips. Next is the platysma, which is tension skin of the neck. Next is temporalis, elevation and traction of the mandible, which is your lower jaw. Next we have the zygomaticus, which is elevation of the corner of the mouth, which is smiling. Then on to table 2, we have the sternocleidomastoid, which is bilateral flexion of the neck and rotation of the head to the opposite side. Next we have the external oblique, which is bilateral trunk flexion, unilateral flex, and rotate trunk to the opposite side. Internal oblique is bilateral trunk flexion, unilateral flex, and rotate trunk to the same side. This. Next we have the rectus abdominis, which is trunk flexion. Can't really show you that very well. We have the transverse abdominis, which is compression of the abdomen. The pectoralis major is shoulder adduction, internal rotation, and horizontal abduction. So adduction is going towards the body, and then horizontal abduction. Next is the pectoralis minor, scapular protraction and downward rotation. Next is the serratus anterior. The upper fibers are the scapular downward rotation, and then middle fibers are scapular protraction. Lower fibers are scapular upward rotation. Next we have the external intercostals, elevation of the ribs during inhalation. And lastly we have erector spinae, which is bilateral trunk extension and maintains posture. Going back, maintaining posture.